Welcome everyone, and thank you for tuning into the webinar, COVID-19 Vaccines, Getting Set to Go. This webinar is hosted by Surrey Place, a service agency in Toronto. We help children and adults living with intellectual and developmental disabilities to reach their full potential through our clinical services, groups, and workshops. My name is Heidi, and I will be your moderator for this event. We have about 100 participants signed up. We don't know if everyone will be joining, but of those who signed up, about 80% indicated that they are a caregiver. And we know many of you have had a very challenging year. We are so excited to have you all with us today to talk about COVID-19 vaccines. I am pleased to introduce my colleagues from our clinical team, who all have many years of experience in supporting adults with intellectual and developmental disabilities. Dr. Bill Sullivan is a family physician at Surrey Place and at the academic family health team at St. Michael's Hospital in Toronto. He also is the clinical lead in our developmental disabilities primary care program, a program that develops guidelines, practice tools, and resources for healthcare providers. Dr. Sullivan will be joined by Kimberly, who is a senior behavior therapist at Surrey Place, Nadia, who is a social worker, Jessica, she's an occupational therapist, and Angela. Angela is a nurse and healthcare facilitator at Surrey Place. Jessica Fox could not join us today, but we thank her for all her input into this webinar. So what is this webinar about? We know from research that people with intellectual and developmental disabilities are more likely to get very ill from COVID-19 compared to people without disabilities. This is an important reason why this group should receive their vaccines as soon as possible. Different provinces across Canada still vary in their vaccine rollout planning, but we are hopeful that by April this year, vaccination will become a reality for many. In the registration survey, many of you indicated to have concerns about when and where to get the vaccine, whether the vaccines are safe, how to deal with anxiety, and what if somebody has a lot of fear for needles, and some other barriers to getting the vaccine. In this webinar, we will first share a framework that will help you decide on getting the vaccine or not. How do you decide on that? So we'll share a framework to help you decide on the vaccine, then talk about how you can prepare while you are waiting. And our team will share tips and strategies for, when you are at the vaccination site. Maybe you yourself also have tips to share with others about what worked well before with other vaccinations. We encourage you to participate in the conversation via the chat function at the right side of your screen. If you find this distracting, you can close the chat window. Just to let you know, this presentation will be recorded, so please keep your microphones on mute and cameras off. At the end of the presentation, we will address all your questions in a panel discussion. Please keep submitting your questions throughout the presentation. Any resources that we're sharing and that I mentioned during the presentations will be shared afterwards via an email, and you will be able to find it also on our website. I hope you will enjoy this webinar today, and I will hand it over to our presenters, starting with Dr. Bill Sullivan.
Well, thank you very much. I'm really delighted to be here and to talk about, I think, a very important topic for caregivers of people with intellectual and developmental disabilities. As was mentioned, I'm a family physician, and I I work at both Surrey Place and St. Michael's Hospital, and have been engaged with many people regarding the questions we're going to be addressing. What I hope to do, very briefly actually, is just to kind of set the stage and provide a little bit of a framework for just even thinking about getting vaccination. So this, just to begin with, is sort of what I would propose as sort of the big picture of making a decision. Um, And there's all kinds of uncertainties that are actually unavoidable. Information keeps changing all the time, but it might be helpful to just put all these facts and uncertainties into kind of a big picture um, that we can uh, kind of then discuss. So I'm not sure what happened there. Um, So, um, the big picture is really four elements that come together in decisions that we make all the time. A first one that I want to highlight is the agent. Um, and that's the person who's making this decision. Um, and it's your loved one. And to kind of keep them in the center of all this. So um, they may need to be, steps taken to involve them in the decision, support them, and help them prepare as much as possible to be involved in this decision. We have uh, done a lot of work on what's called supported decision making, which is a topic for another day. But essentially, the whole point is to involve people as much as possible. It's also important to know that that will also make sure that people are more assenting, even if they can't consent, that they're agreeable, they've been involved, they understand um, pretty much what this is about, um, which will be quite important for them to get the vaccine. The second element of this decision that I wanted to highlight that often I think is overlooked is the goal of this decision. And we can think about various goals that people might have that can be discussed. Primary care, we typically talk about promoting health and preventing illness. Those are the two big categories. So in everyone's mind, the primary goal, I think, is to avoid a serious infection from COVID, and and also to avoid spreading it to others who might also get seriously ill. But there's other goals that can be thought about, uh, particularly uh, being able to end to some degree the restrictions of the pandemic. And we know that they have been very difficult. And actually, today it's a year since the pandemic was announced. So, a year of such restrictions. Um, Peace of mind is another goal. The public good, that this idea that contributing by preventing yourself becoming infected is also going to help prevent other people from becoming infected. Now, the third element that is highlighted in this diagram is means or options. And by that, I'm talking about the various things that can be done to promote the goals that we've just talked about. So the option that we're talking about today is the option of getting vaccinated as a means to help promote the goals we've just discussed. But there's other options. One is maintaining current public health measures. For those who can't maintain those measures, it's basically um, you know um, a third option that to help as much as possible to prevent them from becoming infected. And then the fourth element is labeled here as circumstances. So these are all the particular factors that may be relevant for your loved one. And it could be things that we heard about in many of the questions received, things like fear of needles, allergies. Perhaps they've got other health conditions like seizure disorders or problems with their immune system that also need to be considered. So some of those elements are, I think, what make this discussion a little different than many other discussions, because these are very important factors for consideration and for us to start thinking about, because they can become barriers. So I'm just going to focus in for a moment on this idea of means or options. So one of the options that is the one we're talking about is getting a vaccine. And one helpful way, I think, to think about um, this particular means is that um, it has both benefits as well as risks and burdens. And the whole point of thinking about uh, uh, the right means for your goals, and whether vaccination or the status quo um, is the right means to take, uh, will entail considering whether the hope for benefits are worth accepting some level of risk and bearing some burdens. So almost everything that we do in healthcare will entail some element of risk. It's almost unavoidable. But just to be informed about such risks, discuss them with your primary care provider as needed, and be prepared to say, ask questions about possible precautions or accommodations that might reduce these risks. So there is this connection between risks. For instance, if somebody has a fear of going into a large space, for instance, and burdens, because that might mean that you need to also think about ways of reducing that risk. And that's going to be much of what we're going to be talking about today: how to sort of kind of be mindful and anticipate possible risks, and then to come up with strategies and tips for helping to reduce those. So at the end of the day, the decision is um, this sort of thinking about each of the options that are possible. And I think for this particular webinar, we're presuming that most people are coming because they've kind of gone through this, and there's been a decision that, yes, vaccination is worthwhile um, in this context for my loved one. And so what we're going to focus on are really the kind of trying to anticipate some of the risks and some of the ways that they can be reduced. So I will just close really my comments by referring to a couple resources that may be helpful for involving your loved one in decision making about the vaccine. So these are some resources that are available that have been designed specifically with this in mind: ways of helping to go through pictures to understand what the vaccination is all about and what the process entails. And the other thing that we're going to be talking a lot about with this panel will be ways to support people and bringing in expertise from behavioral therapy and occupational therapy to think about how to support people through this process. And this is just an example of a website from the United Kingdom that spells out in some detail the sorts of what they call reasonable adjustments that would need to be made for people, in this case, with severe learning disabilities, and who have a tendency to have what they refer to as behavioral challenges if they're in certain circumstances that are stressful. So with that, I'll pass it on to Kimberly Taylor to talk a little bit about how to get ready for this.
Thank you, Bill. Hi, everyone. Once again, my name is Kim Taylor, and I'm a behavior therapist with the adult program at Surrey Place. So now we're going to move on to the sort of set portion of the presentation. So how to prepare your loved one in the weeks and days leading up to your appointment date. So first of all, it will be helpful to prepare your consent form ahead of time. So that way, when you arrive at your appointment on the day of the vaccine, your information will already be filled out and the process will be a little bit quicker. If you aren't able to print this out at home, maybe ask a friend or a family member to help you out. You should also connect with your primary care provider ahead of your appointment to review any potential risks, or if you have any questions about filling out this consent form. So now we'll move on to preparing who and what to bring with you. We just discussed the consent form, but it's also important to ensure that your loved one has a valid health card. I should note that the vaccine is free and accessible to anyone in Ontario, but for people without a health card, a government-issued photo ID, such as a driver's license, a passport, or a status card, can also be used. So even if you don't have a valid Ontario health card, this may not be a barrier to you receiving the vaccine. Moving on to who you should bring. If there's someone in particular that makes your loved one feel more comfortable, we may want to have that person accompany them to the appointment. So this is just something to consider well in advance so that you can plan accordingly. It's also important to think about a specific item maybe that your loved one might want to bring with them that would provide them with some comfort. In addition, thinking of some preferred activities or items that might distract them in the moment that, if their anxiety is increasing, they might use an item like a favorite book or music, an iPad or a phone with some preferred videos, or some small fidget items. We also want to consider your loved one's sensory needs and to have some sensory related tools at their fingertips. So something like noise reduction headphones could be helpful, or perhaps a baseball cap that they could wear to block out any, potential bright lights in the environment or the sight of a crowded room. Another important consideration is around establishing a reward ahead of time. It's that motivation piece so that your loved one has something to look forward to after they receive the vaccine and after the appointment is done. We want to be mindful of items that you either can or cannot bring with you into the clinic. So, we might think of something smaller that you might give them immediately after the needle portion is complete, that they might be able to continue to access in that waiting time afterwards before they actually leave the site. And then separately, you might also think of a really fun activity that you could do together once you actually leave the clinic and head home. It might also be something like an activity or a favorite restaurant that they might enjoy, going to get their favorite snack or food, anything that would, really motivate them to engage in this process. It's important to make this experience as positive as possible in order for your loved one to feel that sense of accomplishment and to also want to return to similar appointments in the future. So a few other considerations. We want to ensure that your loved one is well rested, that they've had something to eat or drink prior to the appointment, and that also they use the washroom ahead of time. Another strategy that's been helpful for some is the use of a numbing cream on the arm. And this is an over-the-counter medication that you would need to purchase ahead of time from the pharmacy. And once you put the cream on, it might be helpful to sort of circle the area that was numbed so that the nurse will then be able to guide the injection into the arm appropriately. And if your loved one has been given a pre-medication in the past for similar types of appointments, so for example, a flu shot or maybe blood work, I would speak to your family doctor about obtaining a prescription for that medication again ahead of time. That it could be given to them just prior to the vaccine appointment, just to help decrease their stress level a little bit and to ensure that the experience is as positive as possible. Okay, so next we're going to discuss some tools that you can introduce and practice with ahead of time at home in those days and weeks before the appointment. So priming is very, very important. We want to provide as much information as possible to your loved one ahead of time, of course, based on their level of understanding about the steps that are involved in the process, what to expect in terms of the procedure, the clinic itself, what they might see or hear, how they're going to get there, etc. One very important strategy that has been successful with many individuals is introducing social stories at home well in advance. The social story will help you talk about how the appointment will go. It will provide them with reassurance around concrete details and expectations, and it will augment their understanding through the use of pictures. Reviewing the story should occur on a daily basis up until the appointment date, and it's also important to keep reviewing that story with them so that they become comfortable reading it with you and that it's no longer causing any worry or stress. We have a variety of social stories available around this topic, and we'll be happy to share those with you after this webinar. So during these daily practice sessions, and once you've determined that motivation piece, so those rewards, you might also find it helpful to discuss that process using what we call first and then language, with a reminder of what reward or fun activity they'll get to access after they receive the vaccine. So for example, first you'll get your vaccine, and then you can go to your favorite restaurant. This can be repeated on a daily basis, along with other strategies, as a reminder each day in preparation. And there's also the option of either doing a walk by or a drive by of the outside of the vaccination clinic itself. So if they've never visited the location before, this would just make them a little bit more familiar with the building itself, and also just help to decrease that stress level before the actual day of the vaccine. It might also be helpful to talk to your loved one ahead of time about doctors or nurses wearing PPE, so masks, face shields, and gowns. You could show them some pictures of people wearing these online, talk to them about why these are necessary to keep everyone safe. And it'll just help to sort of desensitize them to that a little bit before they actually get to the clinic. You can also ask your loved one if they have any questions about the day, acknowledge any anxiety that they might have, and develop some coping strategies together if possible. Give examples of when they've gone through a similar experience in the past and how they've overcome it. For example, getting a flu shot. And finally, from a sensory perspective, it could also be helpful to introduce some physical experiences associated with the vaccine. So, for example, holding or massaging their arm, as this could help to desensitize the injection site a little bit. If your loved one has not been wearing a mask, as they haven't really been able to get out in the community much, it might be also helpful to practice wearing a mask at home for increasing periods of time if this is something that's new to them. So many also find it helpful to introduce other types of visual supports, like a deep breathing diagram, other strategies like progressive muscle relaxation, as seen on this slide. And another visual that could be helpful is this arm diagram, which we will provide you in the coming resource list after the webinar. So this will just help the person to keep their arms still while receiving the vaccine. And again, you should practice these many times at home so that your loved one becomes familiar with using them. And then when the time comes for the appointment, they'll be able to use these reliably. At home, you could also practice things like sitting in a chair, having them practice rolling up their sleeve, etc. Also, if your loved one needs some education around physical distancing, perhaps responding to visual cues that you might see at the clinic, you could practice this at home as well. So, for example, putting lines of tape on the floor that are 2 meters apart, having them follow arrows on the floor. All of this will just help them to be that much more successful on the day of. And of course, while you practice, remember to provide lots of positive attention and social praise for engaging in the activities and trying their best. Okay, so in Toronto, when it's your turn to book your appointment, you'll be able to go to the website vaccineto.ca. There's also a phone number to call, and again, we'll provide you these details on our resource list afterwards. If you live outside of Toronto, please check with your local public health unit for more information. Once you've booked your appointment, the government will send you a document with what you need to know before your appointment. We encourage you to review this information ahead of time and then to speak with your family physician if you have any questions. All right, so now that we've planned ahead and done lots of practice, here are some things to remember when leaving for your appointment, followed by strategies to use while at the vaccine clinic. So it's very important to consider your travel plans ahead of time. How will you get there? Will you take TTC, your own car, perhaps an Uber, or have a friend drive you? It's important to leave yourself more than enough time to get there, thinking about the time of day of the appointment, possible traffic, trying to ensure that you're not rushing to get to the appointment on time, as this could increase anxiety levels in both yourself and your loved one. I should also note the importance of being on time within about 10 minutes prior to the appointment, just to avoid waiting in long lines. Remembering to wear comfortable clothing that will allow for easy access to the arm, like a short sleeve shirt. Printing out and organizing consent forms ahead of time, and also making sure that you have your health card or other ID with you. Remembering to bring any visuals that you would like to use, such as the arm diagram or a deep breathing visual, and to bring the social story with you to review with your loved one while you're waiting. Finally, bring any reward or distractor items and review these rewards that you've previously discussed so that they're reminded of what things they will get to do after the process is all done. So motivation is a very key component here in making this a positive experience. So what does it look like when you get to the actual vaccine clinic? And I'm going to pass this along now to my colleague, Jessica.
Thanks, Kim. Good afternoon, everyone. So I'm going to pick up where Kim left off, and we're going to talk about arriving and checking into the clinic. So I'm going to go through the next few steps in a potential barrier and then strategies kind of setup, just so it's a bit organized. So with this step, arriving and checking in, we're looking at potential barriers as being your loved one will have to line up, they'll have to follow rules and markings on the floor for where you stand. They'll be amongst potentially a group of other people that are waiting. They're having to complete forms and share information with staff, or you do that on their behalf. And possibly you don't have the consent form ahead of time. Let's say that you didn't have access to it or you lost it, etc. So strategies for this stage, call the clinic ahead of time for the quickest time. the best time to come. That might be early in the day. That might be right after lunch. Consider the best time of day for your loved one as well. Do they fare better in the mornings or in the afternoons? But know that possibly you may not have much of a choice in the vaccine appointment, unfortunately. Ask if there's a staff member to help. If you do not have the consent form, staff will provide an extra copy and help you fill it in. As you enter this new environment, consider sensory tools your loved one can use in this space. Examples being, as Kim mentioned, noise reduction headphones, earplugs with music to block out environmental noise, a hat or sunglasses to block out bright lights and excessive visual input. Review social distancing rules with your loved one and practice at home, as Kim mentioned, before the actual day. And finally, providing praise and reassurance in the moment for following the rules and waiting appropriately. Moving on to the next step, walking to the station. We're looking at potential barriers and burdens being you're walking into quite a big space, potentially with many people and chairs, bright lights and noises that can be quite daunting. And as we've been in lockdown for the past year or so off and on, keep in mind that your loved one may not have been out in this type of environment for a long time. And some may be quite sensitive to this high amount of sensory input in an environment like that. You're also following signs and markings on the floor to direct you where to go. So potential strategies, ask if you can sit in a quiet area. This might be the edge of the room, the corner of the room, against a wall. If it's really difficult for your loved one, ask if there might be another space altogether that they might be able to administer the vaccine in. Ask for a time so you get a sense and you can share with your loved one how long the expected wait time is before they're actually vaccinated. Give your loved one reassurance and reminders that of their reward after the vaccine is done. Provide distraction with a preferred activity. And I'm going to go to the next slide here. Provide calming sensory input. So your loved one can engage in these types of calming sensory activities if it's safe and if it's appropriate to do so in the space. So the pictures on the slide, one of them is giving a self-hug or giving yourself a hug. Some deep pressure input can be quite calming. Doing chair push-ups, and that's the illustration with the boy with his hands down on the chair and he's pushing down and getting some deep pressure input through his arms. Hand squeezes and releases, or holding a squeeze ball like the picture on the right. So as we continue, we look at getting to the station and rolling up the sleeve. Potential barriers and burdens. There's going to be a lot of medical equipment laid out on the table. There's going to be needles, Band-Aids, which can be quite intimidating and trigger some anxiety potentially. As well as you have the health professionals, the nurses or the doctors in full protective gear. So they're wearing face shields and masks, and they will be wearing gowns as well. So potential strategies. Make sure your loved one wears something that's easy to roll up or expose the arm. Again, short sleeves or something that can be zipped down. Your loved one might need help or may want to roll up their sleeve on their own, and this is something that you can practice ahead of time. This might be a great chance to have them involved in the process as it gives them something to do and gives them a sense of control. Talk about what doctors and nurses will be wearing ahead of time, why they're wearing the PPE, and as Kim had mentioned before, using pictures to facilitate that discussion. Deep pressure touch or massage to the injection area. So that's the bicep muscle. may help desensitize the arm for those that are touch sensitive. So we're not looking at any type of very technical massage. We're just looking at some deep pressure and maybe rubbing the area a bit. And that deep pressure can kind of desensitize to the light pressure touch that they'll be exposed to with the needle. If your loved one will have difficulty sitting still for a long period of time, ask if the needle can be prepared ahead of time before he or she sits down. Okay, which brings us to actually getting the vaccine, getting the shot. So potential barriers or burdens. Your loved one might have a fear of needles. They might be touch or sensory sensitive. And the nurse or the doctor, the administrator of the needle, will be coming in quite close contact. So potential strategies: explain to a loved one that the person administering the needle will have to get close to them and that is okay. So that it's breaking, in theory, it's breaking social distance rules that they've become so accustomed to over the past year, but in this situation that it's allowed. Encourage deep breathing with or without visuals as practiced at home. Look away or at a distractor item or a person. So this could be while the needle is being prepared and or during administration. Squeezing a stress ball or holding a fidget item. And what this does is gives an outlet, so to say, for the anxiety. It gives the individual something to transfer the anxiety to if they're squeezing a stress ball. Use the arm diagram to keep their arm in place, and I'll be showing a picture of the arm diagram in use in the next slide. Ask your loved one to think of something positive, so a favorite place or a favorite activity. Remind them of the first then. First I get the vaccine, then I get the reward. Remind them or review each step of the process. So the nurse will first wipe the arm clean with an alcohol wipe. They'll pinch the skin very lightly, not pinch, but pinch as in gather up a piece of skin to be able to inject the needle into. They'll give the needle and then they'll put a Band-Aid on following that. The nurse or your loved one might count down to the needle injection. So 5, 4, 3, 2, 1, needle, and or count down to the needle removal, so the completion. So 3, 2, 1, all done. So here's a picture of the arm diagram that Kim had mentioned earlier in the presentation and that I just mentioned could be used during the actual needle vaccine injection. The arm diagram just gives the individual place to place their hand. So whether there's a table available or in the right-hand diagram, if they're placing it on their lap, it just gives them a target area with the goal of keeping their arm still while the needle is injected. Finally, if you're considering an alternative injection site, so as opposed to the bicep muscle, the arm, that's something that you can discuss with your family doctor before making an appointment. Okay, next is documentation. With potential barriers or burdens being there are multiple points where people have to see your forms and put information into a computer. They might ask you questions. You will get more documents. That explain how one may feel after the vaccine and what to do. And potential strategies, review social distancing rules again with your loved one. Keep all forms and documents organized and easily accessible. So whether you're bringing them in a folder or a Ziploc bag that you can close up, that keeps everything in one spot. So you're less likely to drop or lose something. Update your loved one on the number of checkpoints they still have to do. before they're all done. Explain why they're being asked all these questions. Explain why this information is important. And reassure your loved one you can review the forms together at a later time. So maybe when you get home, you can go over in communicating in a way that they'll understand what all these forms mean. Okay, following that documentation stage, we're looking at a making sure you're okay stage. There is a waiting period. You have to wait at least 15 minutes. It might be longer depending on the clinic and depending on your loved one's pre-existing health conditions. To make sure you feel okay, that could take it could be a longer duration, and again, it could be in that same space. So it might be that busy gym, for example, or that's what the pictures document. So potential strategies: ask for an alternative quiet space to wait, at the edge of the room, against the wall, or another room if it's available. You can also turn the chair towards the wall so he or she isn't looking at the busy room, that they have a view of the wall, and it might help address any of that anxiety of waiting. There's the option to provide that reward now and or after this waiting period. Use a preferred activity to distract and occupy his or her time, and to bridge that gap between the waiting period time before leaving the clinic. So maybe if you've brought the iPad, they could watch a favorite show. Again, they could listen to some music, something that might distract to kind of fill in that time. Excuse me. And you may use a timer to help tolerate waiting. So for example, a timer on the phone. There's a lot of free visual timer apps available for cell phones and for iPads, and that's definitely something we can provide a list of those in the resources following the webinar. Okay, and finally, checking out. So potential barriers and burdens being not knowing when your follow-up appointment is. It might be recorded on a small piece of paper, similar to the picture in the right, what the individual is being handed by the staff, and that could be easy to lose. And not knowing what to expect in the days following the vaccine. So potential strategies: take a picture of the slip with your phone. As mentioned previously, you may bring a folder or a large Ziploc bag that day for all that paperwork and your health card, or your loved one's health card. Ask staff to sign a vaccine diploma. So Surrey Place staff have developed the one you see in the middle of the screen, which includes the date for the next shot. If your loved one is someone who may fixate on days, you may want to put a more general time frame on the diploma. So for example, June, July, in case the day does change. Provide a reward if you haven't done so already. At a later time, review with your loved one how they may feel over the next few days. For example, they may have a sore arm, they may be tired, and that these symptoms are completely a normal reaction, but that it's important to let you know if they are feeling this way. Your loved one may need to be monitored for more severe adverse reactions. So those are reviewed in some of the documentation you'll get the day of, but this includes hives, swelling, fever, etc. Provide lots of praise for completing the process. Remind them that social distancing and wearing a mask in public spaces will remain in place even though they have received the vaccine, to keep everyone safe and healthy. Make note of any successful strategies this time around and any difficulties, so that you can consider them for the second vaccine appointment if that's applicable. Okay, so that's it. What I'm going to do now is summarize what's been presented and some general take-home messages. So first says, know the person you support and his or her individual needs. So some of the strategies presented may be applicable and some of them may not. You know your loved ones best, and you know what will best help them. Weigh the risks, the burdens, but also the benefits of getting the vaccine. So if the risks outweigh the benefits, it's your decision then whether this way of getting the vaccine is right for your loved one, or if you have to talk to your family doctor about other options. Start planning now together with your loved one weeks ahead, so that you might develop some of these strategies together and have the time to go over them together. Think of strategies that have helped in the past, again, in similar situations, like getting the flu shot or going to doctor's appointments. If you need support, reach out to the clinic in advance and create a positive experience as much as possible, knowing that, again, for some, they may be returning for a second dose, and you want overall the experience to be for your loved one to remember the experience as a positive one. Okay, thank you.
Thank you to the presenters for the tips and strategies. And thank you for everybody submitting their questions. We're about to open up the presentation to the panel discussion. And I first would like to acknowledge that and repeat what Jessica said. Everybody's individual situation is different, and you know your loved one best. Some of these strategies might work, some might not work. We hope that you get a few takeaways of this presentation and discussion. Let's see. Many of you have submitted questions in the survey before the registration, and many people have the same questions. So opening up the panel discussion, we will start with some common questions that people have. And I would like to welcome Nadia to the panel discussion. Nadia is a social worker. Nadia, can you maybe start sharing a little bit about when people can expect to get the vaccine for their loved one or with their loved ones, and where this will happen?
Sure. So in Ontario, so every province is different and every public health unit is a little bit different. But I would say for Toronto, people with intellectual disabilities would be in the second phase, according to the Ministry of Health information. So that is supposed to begin in April. And the registration portal, there's a City of Toronto one that's available now. And then there's also going to be a Government of Ontario portal as well. So I think part of the challenge is that the information is always being updated and changed. So you just need to keep your ears open to what's on the news, and also the city website. So for most of our people we support, it's still to come, unless they're receiving ongoing home care. So this is people who have like a PSW coming in, or maybe more complex medical needs. They might be eligible now to get it in phase 1. And if you're supporting someone in this senior age, like 80 plus, they would be getting it now. And then just in the news, those people in the early 60s, under 65, could access it through a pharmacy if any of your family members are in that age range. So I think, does that answer the question?
So maybe Heidi, I'll just add a little comment. It's true that this is a moving kind of scenario, and I think the message about checking back in with your family doctor, they're keeping up with this, and also for people that won't be able to use these big vaccination sites. So I was just looking through, there's a good document that the government of Ontario published on March the 5th that outlines all these details. One detail that I wasn't really clear about is this provincial website is actually to sign up for one of these mass vaccination sites. So I saw a number of people saying that, that's just not going to work. So it's good to know that, because you'll need to kind of, I think, connect with your family doctor or nurse practitioner, let them know about those needs for different types of accommodations, and then see what can be worked out. I guess the other thing I'll say is that for phase 2, which is not that far away, it's supposed to begin in April, that's when primary care gets involved in providing vaccines. And so I'm hoping that that means there will be more flexibility for, they will know your circumstances, and they're the ones who will need to kind of help think about strategies that would help. And I guess the only other comment I would make is that kind of going back to the beginning of, the person kind of being in the center of all this, it does make a big difference that the person is willing to be vaccinated. So the scenario where somebody really doesn't understand it but isn't willing is more complex, and I think for many reasons. And so if it's about, a certain thing that can be addressed, now there's time to address that. Say, we know about 10% of the population has a very significant needle phobia. And, it takes time to work on that. But it shouldn't be, I think, that because of that phobia, they're not going to be vaccinated. That some of these barriers hopefully can be addressed, and we do have some time to do that.
Thank you, Bill and Nadia, for those answers. Just a reminder to all guests and participants to keep your cameras off. This presentation is being recorded. So some follow-up questions to the previous. If we've been told that we're getting a vaccine through, in our case, CLT, so Community Living Toronto, or some similar agency, because as Nadia says, we're getting home care, is it still wise to sign up for other options to cover our bases, or does that muddy the whole system? Nadia.
So on the city and the ministry website, I think they discourage you from signing up in different places, because then that would take up different spots. So I think if your support agency is saying that they're going to facilitate it, then I think you would trust that. I mean, if time goes on, you might just want to go back to them and get some more information and clarification. But I think if the residential agencies are facilitating that, then I would trust that.
Mm-hmm. And Heidi, I'll just add to that. So I think one of the things that motivated us to talk about this issue is that we also recognize that there's a large number of people in the province who are not connected to an agency. So if you're connected to an agency, that's a big bonus. Also, we know that there are some people that might not currently have a connection with a family physician or primary care. That's something that is also very important to address as soon as possible, if possible.
What about eligibility? Do we have to show proof of disability to get the vaccine?
So maybe I can start on that. There was, in the newspaper recently, the Minister of Health for Ontario said that no such proof is needed. And that's not about a disability, but it's also about other medical conditions that might put you into a higher risk category. So that's what the Minister of Health for Ontario said. And we're hoping, and she was also quite clear that she thinks everybody sort of in the province is going to be honest about this, and they know that it is important for people at higher risk to get vaccinated sooner.
Yeah. And I think with anything around this, it's always important to just keep monitoring the news about any announcements about it, right? And maybe related to this too is, what if I don't have a health card? Can I still get the vaccine, Nadia? Or what if it's, expired?
Yeah, so I think that especially in the city of Toronto, they want to make sure that people have access. So you don't have to have a health card if you have any government issued like photo ID, a status card. I think on the radio this morning they said like a passport, a birth certificate, anything that just proves who you are and your date of birth. And I think it's more for tracking purposes rather than to deny people the vaccine, so that they can record how many people had it and book your follow-up.
Yeah,
Bill,
I
go
mean, I
ahead.
would just also comment that one of the priority groups are people who are homeless. And of course, there's all kinds of documentation issues for that group. And we also know that there are a number of people who are homeless because of an intellectual disability. And so for sure, they're minimizing barriers. Um, and I think this type of documentation could be one. The other potential barrier could be consent. And it's just to know that you have to provide written consent in this form when you arrive at the clinic that is dated, and it's signed by someone. That would be, if the person themselves cannot provide consent, then somebody who is in the position to sign that form, probably a substitute decision maker um, or a legal guardian, they would need to do that. And again, I just note that, but I don't think it's going to be a barrier. Um, and again, there's been a lot of experience with this in vaccinating all the people in long-term care for whom this is often also an issue.
A question about the caregivers, actually. So, we've heard a lot of advocacy in the news about why it's so important that people with intellectual disabilities get vaccinated as soon as possible because of their underlying health issues, etc. What about the caregivers, the primary caregivers, but also other caregivers around this person? Should they not get vaccinated at the same time? Bill, Nadia.
I'll let Nadia go. Yeah.
Sure. So according to the government documentation, they would all be in phase 2. So if you're a caregiver of someone with a chronic condition, if you're working in these congregate settings, and you can't work from home, so it would all be in that same phase. Now, whether or not it could be on the exact same day and same time, we don't know. You might have to advocate a bit for that, but they're definitely all in that same grouping.
Yeah, so just to add to that, on this document that the Ontario government has just published, they spell out, who are essential caregivers, and that they're fairly specific about that they're caregivers of people categorized in the high risk health conditions, and it's the primary caregiver. And then they give examples. One example is neurological diseases, but then they say in which respiratory function may be compromised. So again, I don't know how sticky they're going to be about that. But the other thing is that they say that these caregivers would be vaccinated at the end of phase 2, at the same time as workers who cannot work from home. So it suggests to me that they're not envisioning that the caregiver get vaccinated at the same time as the person, which is just inconvenient. And it's kind of too bad, but that seems to be the case. And I think what they're envisioning are these mass vaccination sites, but it may well be quite different if it's your family doctor doing the vaccination, or anyway, it's worth a discussion, because of course it makes much more sense to get vaccinated at the same time.
Follow-up question to that, Bill, from the chat. Will family doctors be vaccinating come April this year?
Well, this document says they are, and based on my involvement at St. Michael's in the academic family health team, we're already discussing kind of a pilot project to start vaccinating. It may be that for family physicians, they will have the vaccines that are not quite as technically difficult as the first two vaccines that became available, the Pfizer and the Moderna vaccines, which require very cold temperatures that most family physicians would not be able to kind of manage those restrictions. But the newer vaccines that have just been approved don't require that. And actually, another thing that I'm sure many people are hearing about is the Janssen vaccine only requires one dose. So if this is going to be, difficult to do even once, that could be a consideration. And I suspect that the family medicine would have access to that vaccine, and the other one is AstraZeneca.
Thank you. Someone asks, does it make sense to get vaccinated the same day at all if it's possible both the person and the caregiver having reactions to the vaccine? So this question leads us into, talking about the vaccines itself, like, is it safe? Are there side effects? How do you feel after? So I'd like to switch to Angela Gonzalez. Angela is a nurse and healthcare facilitator. And then after that, we'll switch back to Dr. Sullivan with some more specific medical questions for the developmental disabilities group of people. So Angela, are the vaccines safe?
Yes, the million-dollar question. Definitely, I'm saying that it's safe, along with the huge governing bodies, along with the global networks that are all saying that it's safe to get these vaccines, and it's a priority for people to get them. And just again, saying that it's in the context of preventing serious COVID disease and possibly death. And balancing that with what could be unpleasant side effects. As mentioned in the presentation, unpleasant side effects like feeling mildly ill after the vaccine, having some soreness, some fatigue, chills, pain where the injection site is. Those were mentioned all in the presentation. So again, yes, they are safe, and they have been through very rigorous processes through these huge governing bodies all across the world. And in terms of rare side effects, the rare side effects that are listed are things like allergic reactions, something more serious like anaphylaxis. But around the world, they're collecting data about how rare these things are. And there are safety nets in place as well.
Thank you, Angela, for that reminder of weighing the risks and the burdens over the benefits of not getting very ill of COVID or even possibly dying of it. Related to the safety, etc., and there are many questions about which type of vaccine. So Dr. Sullivan, is there a specific vaccine that is recommended over another for people with intellectual disabilities? And do I even have a choice?
Good questions. So again, these are the big questions of the day. Just to preface my remarks by saying that I'm not an infectious disease or immunology specialist. So like you, I listen to the specialists, and I'll just kind of relate what the specialists at St. Michael's, who's Matthew Mueller is his name. He sort of gives us advice about these questions, and this was one of the questions asked to him. And his answer was, the best vaccine is the earliest one you can get. So that people are getting all caught up in details. I think that it's interesting and it's evolving, but some of these details are a little bit alarmist. Comparing efficacy and so on. The big issue is the only reason that, and this is what Matthew Mueller said, the only reason we're thinking about getting vaccinated is that we're not talking about preventing a runny nose. And that's actually some of the debate is, do you get a runny nose or you do get nothing if you are exposed? We're not worried about the runny nose. What we're worried, and this is what he said, what we're worried about is people being admitted to hospital, getting very sick, possibly dying, possibly being left with long-term disabilities because of COVID. And all the vaccines that have been approved for your age group, he said, do an excellent job. So if that's, if that's a fair assessment, and he's sort of much more on top of this than I am, then I do think that the considerations that are coming up in the chat about accommodations then rise to the top. That should be what you really should be thinking about. And it may be that a vaccine that doesn't require you to, because most of the vaccines that are being given out in these mass vaccination clinics are the ones that we won't get in primary care. It's the ones that require very cold temperatures. So the vaccines that primary care will get will be at least hopefully one of them is only one dose, and it won't be quite so complex. And so it may be that there's a little bit more room to accommodate various needs, including home visits. Now, maybe that's, many of my colleagues might not be that keen on doing that because if we're talking about a lot of people, that's a lot of home visits. But I think that from what I was hearing in the chat, there are going to be some people for whom that may well be the best and maybe the only option.
Thank you. Yeah, and it's so helpful to hear from all of you, the participants, actually, because while we are working through advocacy, etc., it's so important to hear what you need and what kind of accommodations you are thinking of. Before we go further into accommodations, Dr. Sullivan, a few specific questions that keep coming up about the medical issues. What about people with epilepsy, people with rare genetic disorders, and people with allergies? Very briefly.
Mm-hmm. Yeah, those are actually, we've done another webinar, and these were the big questions. And in fact, we've prepared a nice kind of brief document that addresses those questions that we could maybe share after the webinar. But I think one of the things that I was attempting to do by framing the big question is that these will be kind of risks to consider, allergies and so on. The thing that is what you're comparing that to, that package of benefits, risks, and burdens, to not being vaccinated and the increased risk of actually getting sick, and what that's going to look like. So some people are comparing that I might get a risk from this injection, but if I don't get the injection, I don't have any risks. Well, that's not really a fair comparison, because really what you should be comparing, if I don't get vaccinated and I get infected, what's that going to look like? So all these kind of, to me, that's the context for considering risks related to allergies, seizures, and poor immune systems.
Yeah.
As far as I can tell, if you get sick, the risks are way bigger than the vaccine.
Yeah, and I just want to repeat maybe also what Angela said before. When you, and we saw in the pictures, when you are at that vaccination site, there will be a waiting time to make sure you're
Yes.
okay. And there are people around and medical people around that can help you with any adverse reaction, right?
Yeah. Just to add to that, so everybody has to wait for 15 minutes, and that's because there's a risk of about 1 in 100,000 that somebody's going to have an allergic reaction. So just think of that. We're all waiting because of that pretty rare risk. If you've ever had an allergic reaction to anything, so some people have mentioned other shots. By the way, these vaccines, that could be a good discussion with your family doctor, because they're much less likely to provoke any allergic reaction, even compared to the flu vaccine. But if you've ever had a previous reaction, you're to wait 30 minutes just to be extra careful that you don't have a reaction, because they can treat it. It's like people that react to a bee sting. You know, there's medications to treat that, and then you get over it. It's not something permanent. It doesn't, you know. So anyway, that's worth thinking about.
Yeah, thank you. Angela, we're hoping that these vaccines will get us back to normal, right? It's been a year of lockdown and public health restrictions. People are asking, so when I get this vaccine, the first shot or the full vaccination, what can I do again? Will day activities and services, what opens up after? What can I and what can I not do?
Yeah, so we've seen that it will help. The more people who get the vaccines, the more things that will open up. And in terms of developmental services, similar to how getting a mobile COVID test and getting faster COVID testing really helped with programs to start intakes again and receiving people in residential programs. I think this is similar in that the next phase is the more people who have the COVID vaccines is the better these agencies, whether developmental services or not developmental, whether they're community services that are opening up, it will definitely push to help us get out of this. But meanwhile, I know another common question is that, you know, should we still be wearing our PPE and continuing to follow public health? So just to emphasize that, yes, because remember the vaccines are not being given to people under the age of 16, under the age of 18. So we still need to, and there are other considerations where we still need to continue practicing PPE and other social practices that will help.
And very briefly, before I move to some more accommodations and behavioral questions, Angela, why is it that people with IDD are more likely to get sick than others from COVID?
Yeah, I saw that question. A really good question. That what makes people with IDD different in that sense? There's a higher prevalence of health issues that would make people with IDD more unique in that sense, where they're at higher risk. So various conditions that Bill also mentioned and in the presentation that could make people more at risk in addition to having an intellectual disability. There are physical conditions that are at higher prevalence.
Thank you. Kim, there are people that have still, you know, many concerns about the anxiety. You know, what if somebody really panics in that situation? Some say, you know, all this preparation, the really great tips, but it's not going to work. What about the option about pre-medication?
Yeah, so I think, you know, of course, we want to ensure success. And if you have been, you know, if you have brought your loved one to, for example, have blood work in the past and maybe use that pre-medication and that's been successful, you know, giving them that ahead of time will just help this situation to be much more successful as well. So decrease their stress level and their anxiety. And just help them tolerate all the steps of the process.
Maybe I'll just make a supplementary comment. So somebody's been asking, like, what if we've never done that before? Which is a good question, because I think one of the other messages was about practicing. And, you know, one strategy might be if the person has never had one of these medications, you know, a typical one would be a mild sedative that would last for about 4 hours. Not everybody becomes sedated by that medication. Some people, it makes them more hyper. So it would be prudent to not, you know, try something new the day that you're getting the vaccine, and maybe plan to try it out, kind of a practice run beforehand, just to make sure that it works, that it's sufficient dose, not too much, and that the person, it is doing the effect that was desired.
Jessica, there's not a lot of time left. What's your take-home message about the accommodations and preparing?
Yeah, so I think one of the main messages here was about preparing as much as possible ahead of time, and having your loved one experience as much as possible that they can at home what they will be experiencing the day of in the clinic. So although we can't recreate it exactly, recreating some of what they might see via pictures, what they might see via tape on the ground or signs, using visuals well ahead of the appointment, such as a social story that goes through the process step by step, first then visual to review that preferred item that they might get after that unpreferred experience. Practicing deep breathing again with visuals, and practicing or getting that experience of the physical experience that they would be having, wearing a mask, touching of the arm. And then just making the experience as comfortable and positive for them as possible. So bringing familiar items or items that might accommodate any sensory sensitivities that they have, just to make it the best experience that is possible for the individual.
Great. Now, even with all the prep and preparing for that specific appointment, the day of the appointment might be not a good day, right? It might happen that the person doesn't feel well, or something might come up. You can't make it to this appointment. Is it possible to reschedule these appointments? Very practical question. Do we know?
Well, I guess I don't quite know, but I'm sure that this is going to be an issue that will happen. It just happens. And I think I'm just thinking that from the point of view of the vaccine clinic, they want to use up the spots. So, one possible strategy would be to, if you have a choice of an appointment time, book it later in the day. And if it's not a good day and in the morning, you can let them know and they can fill that spot, give you another day. But yeah, that's a good question.
And there's a very good question coming in, and I would like to close with that question before we wrap up. Is there anyone we should be advocating to get people with disabilities to be considered more closely? Dr. Sullivan?
Yes. I think that advocacy works because, it wasn't that long ago when people with intellectual and developmental disabilities were not actually listed in phase 2. So that's, to me, a positive result from advocacy. And I think that where that goes and how it's done, I'm not sure. Maybe Nadia can help with that. But I think that it's worth doing. And I think people have pointed out that there's going to be possibly a significant number of people in the province who are not going to be able to follow the kind of the process that's being mapped out for the general population, and that needs to be thought through.
Sure. So I think that, in terms of the City of Toronto, they're kind of organizing the public health response, and they're trying to reach out to different vulnerable communities. So I would hope that reaching out to the city would be a good idea. And I think that if enough families and individuals are concerned, maybe this is something we can take back to our leadership and see, what information and supports they could provide.
And I would just quickly add that everyone with IDD in Ontario is usually registered with Developmental Services Ontario. And if they can keep their profiles active and updated, that may be a resource as well, because DSO is connected to bodies like community networks of specialized care, where, for example, with my role, we can also try as much as possible to advocate and to try to help individuals with accommodations, basically.
Thank you, everybody, for your questions. So helpful to learn from you. Thank you to the panelists who prepared all these strategic tips, and to other people behind the scenes who helped preparing this. Thank you for joining us today. I hope this webinar was useful and helpful to you, and that you feel a little bit more ready and prepared to go get the vaccine with your loved one as soon as it is the time to go. And we will be sharing all resources mentioned in this presentation in a follow-up email, probably a week from now. So please watch your inboxes. And next slide. For any resources, you can also go to our website at ddprimarycare.surreyplace.ca, which is a website for healthcare providers, but also has a lot of resources for caregivers. And if you have any questions left, please don't hesitate to email us at ddpcp@surreyplace.ca. Thank you so much, and have a wonderful rest of your day.